Hey, this is Dr. Jeremy Gearman with Inertia Medical, and today we're talking arthritis. So this is a big topic, but it's one that we discuss every single day in clinic with patients. Patients will come in and say, Doc, my shoulder hurts, my hip hurts, my knee hurts. Is it arthritis? And if so, what can be done about it? So again, big topic, but we're gonna give a little bit of an overview as to some different treatment considerations. Many different types of arthritis, but if we focus specifically on osteoarthritis, we used to tell patients this is just really a wear and tear phenomenon. As we live life, we experience different joint injuries, and our joints just kind of wear out over time. And while there's certainly some truth to that, we're learning much more. So there are many different chemicals involved, our immune systems are involved. So this is now allowing the opportunity to intervene at different points in order to not only change symptoms, but also potentially change the course of the disease or the condition. And we'll talk about some of these examples. But something else that's important to consider is that patients will routinely come to us with an MRI or an X-ray of a given joint, and that's very helpful. The more information we have, usually the better off we are. But it's very important to remember that we have to treat the patient, not the image, because, for example, we'll often get a knee X-ray and find that this knee X-ray that does not look very good, the patient's not having many symptoms, they're not having a whole lot of pain. Whereas we can contrast that to someone whose X-ray looks pretty darn good, or their MRI looks pretty darn good, but they're having a ton of pain. So it doesn't always correlate, and that's why you always have to treat the patient and not the image. But if we start to think about treatment strategies, one of the first places that my mind goes to, particularly as a rehab physician, is to exercise and biomechanics, because you can recognize the fact that we develop certain habitual movement patterns. So every time you go to bend over to pick something up, you'll tend to bend to the same side, or every time you carry things, you'll tend to carry it with the same arm. And that leads to imbalances, and it leads to uneven wearing of joint structures. And it's sort of like bending a coat hanger one too many times that it'll snap right in the middle. So we want to be sure to evaluate for those things so that people are properly loading joints, so that they're strong around joints. And so a lot of times we'll recruit the assistance of a physical therapist or a trainer, or we'll teach the patient some exercises to perform. That's very important. Beyond that, I'm really big on talking about nutrition. I really think it's a shame that we don't talk more about this in medicine. Often time is a constraint, and I just even recently had a patient who said, I went to a primary care physician. They said, well, what you eat doesn't really have any bearing on your arthritis or joints and that sort of thing. And it just isn't correct. Now, while nutritional sciences are very tough, and it's difficult to study diets and nutrition and how they influence the body, there's just no question that what we consume affects the degree of inflammation in our body and how we feel and how different conditions progress. And just from personal experience with some old injuries, when I'm not eating so well, I have aches and pains, but when I'm eating very well, that's much reduced, or I might not have any pain. So it's very important to me that we talk about nutrition. And there are some nutritional supplements that I think can be advantageous for certain patients. Things like glucosamine and chondroitin, or curcumin or boswellia, and different anti-inflammatory type of products that sometimes come up in discussion. Beyond that, there are the oral medications that most people are familiar with, the Advil and the Tylenol and that sort of thing, and these also can certainly be appropriate. But I'm not such a big fan of taking the oral medications every day, because every medication, of course, does have side effects, but they can be very appropriate to facilitate normal life and participation in activities and what have you. But we tend to focus a lot on focal joint treatments, meaning instead of giving a pill that goes all over the body, we focus on the joint when it comes to various focal treatments like injection therapies. And one example of an injection therapy is a corticosteroid administration. Most people are familiar with that. And we're reducing inflammation. We're therefore reducing symptoms. And these are also appropriate in the right patient and in the right circumstance. Like, for example, sometimes if a patient is having particular difficulty participating in physical therapy due to their degree of discomfort, we might do a corticosteroid injection to get them over the hump and use that as a bridge therapy. But we don't like to do it with much frequency and too often, because we do know that these medications aren't the healthiest for the joint. In fact, some studies have even indicated that corticosteroids can be toxic for cartilage cells and tendon cells and that sort of thing. So we're very careful about that, but certainly can be appropriate in the right circumstance. Beyond that, there are different gel injections, hyaluronic acid injections, because as our joints wear, the cartilage is part of that wearing process. So they move a little bit less smoothly. There's not quite the shock absorbing qualities now that there used to be. And if we administer a gel injection, sometimes that can help with some of that shock absorption and smooth movement of the joint. So that can be appropriate for the right patient. There are also a whole class of regenerative treatments, things like platelet-rich plasma and allograft growth factor injections and stem cell therapy, which might be derived from the patient's own body. And while we can look at those individually in different videos, the idea largely is the same. If we have a problematic joint, then if we administer growth factors and healing chemicals and healing cells, then hopefully we will lower inflammation, enhance the health of the joint, increase the robustness of different structures in that joint, heal various areas of the joint. So that's kind of the overall idea with those type of treatments. And there are more and more these days, and we've noticed that patients have been just had really good results with those. So that's another option for patients. Of course, surgery is always can always be a consideration in the right patient, and for some people it is in fact the appropriate treatment. But most patients will want to exhaust conservative measures first, and fortunately these days there are many conservative treatments that can be very beneficial for people. So hopefully that was helpful to consider, just kind of an overview of different treatments that are available for osteoarthritis. If you have any questions, feel free to send them our way. You can either reach out to us on our social media accounts at Inertia Medical, or you can email info@inertiamedical.com. So feel free to send your questions our direction. And again, hopefully that provides you with some assistance there.